Chris Rigby was in Botswana when his way home became way more complicated. He's still stuck in a Toronto quarantine hotel despite testing negative for COVID days ago.
There doesn't seem like there's anyone logistically that's taking charge or that's been put in charge to kind of take care of, of the guests in the hotel.
Canada's public health agency is overseeing the quarantine of Canadians returning from 10 African countries. They must now stay at a designated facility until they receive a negative COVID test. Then they can leave the hotel and self-isolate for the remaining 14 days. But while the government is paying for the rooms, those at the hotels describe confinement without clarity.
Financially, physically draining, mentally draining.
Sarah Masad was visiting her grandma in Cairo. It took 30 hours between getting negative results and Masad being allowed to leave the hotel.
Honestly, at every single step, it felt like this was the worst part, but then there was another step that was worse.
Soon, Ottawa says all returning air travelers, except those coming directly from the U.S., will be tested on arrival and asked to make their own arrangements to isolate until they get a result. But testing at airports is still ramping up to support that policy.
This will require more time, and that people should be factoring that into their travel plans, but it's a necessary and fair trade-off.
It's a hodgepodge of approaches that isn't ideal by any means.
Instead, the government should shorten the 72-hour testing window before people fly to Canada, says this epidemiologist.
And adopt a more universal strategy towards testing. I like the idea of having testing 24 hours before a flight.
That policy has just come into effect in the U.S., catching some Toronto travelers off guard.
I know it's causing a lot of people some trouble today.
Just be on top of all the rules that are changing.
Sage advice as the holiday travel season looms. Ellen Morrow, CBC News, Toronto.